Black Americans have higher rates of high blood pressure. High blood pressure is a leading risk factor for kidney disease. If you do not monitor your blood pressure and it's out of control, your chances of developing kidney disease are higher. Healthy kidney function regulates your body fluid level. It filters out toxins and waste. It produces hormones and products that you need to make red blood cells. It also regulates your bone metabolism. So when you have poor kidney function, you may find that you have increased swelling, you feel fatigue. In the later stage of kidney disease, you might have a funny taste in your mouth because you're not removing the toxins. The steps that anyone can take to prevent kidney disease is to maintain a healthy lifestyle. You want to monitor your weight. You want to limit your alcohol intake, not smoke, and also have a physician. You want to have a physician on your team. Oftentimes I find that my male patients are hesitant to come in and to see the doctor. So I always often, even though I have no skills with cars, I do not know cars, I always say to them, when you're driving your car, what do? You take it in for maintenance, right? Because you don't want any surprises, you don't want it to break down. So I do the same thing when it comes to the body. I feel that patients or people in general should see their doctor at least yearly if you're healthy, right? Because in that 1 year visit, which I always say do it around your birthday, like a gift to you, so you can have long life, right? You can get your blood work checked and you can see where all your numbers stand. I think patients should understand that, they get a diagnosis of diabetes or they get a diagnosis of high blood pressure, that oftentimes it's not their fault, right? Because a lot of patients take on that it's my fault. There are so many factors that contribute to the way the healthcare system is, and even diagnosis or inequities. Again, with social determinants of health, of like where you live, access to certain foods, access to even being able to walk outside and exercise, those things contribute to your health, your overall health. So again, when I speak to patients, or I think that patients should know that, yes, you have a diagnosis, you have to do your part, and you have to partner with your doctor to get the things under control. But the feeling of it's your fault, majority of the time there's other systems and other things that contributed to that diagnosis.